So what does that mean? So what it does, it shifts a healthcare system from acute to follow-up kind of care, longitudinal care. And that will become very transparent and dynamic systems with all data we use. And to a designed for, especially for the patients and their need. I would like to highlight some of the points in my presentation later on. So what are the roles with electronic health records? So while we are just behind electronic health record system in the country, there's so much abuses. For example, patient informations, details. Suppose one patient had appendectomy many years ago, patient had history of right iliac fossa, we don't know whether the patient had done surgery or not. We have that records of the patients, whether the patient has done this surgery or not. Continuous quality improvement. I would like to focus on this idea. Continuous quality improvement. How data is going to show you. Monitoring and evaluation. Policy guideline preparations. Suppose we have got a patient with diabetes. I would like to start medications and my paramedics is going to start the medications. And how is that possible? It's because of the policy preparations on the basis of the data we have. So diabetes ranking number 3 in the hospital. COPD mortality number 1 in the hospital. That's why we have developed some policies in COPD. And I would like to share some of the articles of that later on. Budgeting is one of the very key information that we need to have. For example, we need to have budgeted. We need to budget for 1 year. A lot of programs are there. So the focus is because of the electronic health record, we have got all the inventory managements, human resource data, and everything. So we get them right here, and then we budget accordingly. And that is going to be very realistic. It's all about realistic information we get it. Like 100 plus minus 10% is. So what about the budget we have utilized last year? Is it 10% is or 150% is? So if we are realistic, we would like to use that 100 plus minus 10% is. So Sanjay was showing this picture in the morning. So Nepal EHR, we register patients, clinical services, we register in lab services, we give inpatient management strategies, stock management, billing and accounting, reporting, tax integrations, using so much of open source softwares right here. Open MRS, Open LS, Open ERP. So this is one of the examples. So how do you look if you are going to start Nepal EHR? So you have this platform. So my patients, I am starting these patients. 2 days, I have listed 218 patients registered. Admitted, there are 15 patients. So these are the people registered from the registration side. One example is like this. I would like to give you in detail. So what you are going to do, we are going to click in clinical part. I would like to fill all data, like what is the problem you have. So I would like to give data on that. History, examinations, diagnosis. I would like to send patients to laboratory or X-ray department or to pharmacy. This is the dashboard that we see how many times patient was here in the hospital. What were the diagnoses with that patient? So what is the new diagnosis we are taking care of? And we also get X-rays in the EHR. So we don't need anything besides that. We have one dashboard with everything, all the information's there. So there are some sets up. For example, if patient has abnormal finding, so what we get? Abnormal results. So that clicks you that you're not going to miss this result in the patient itself. HbA1c positive. Wow, this is sometimes missed because we forget to see the reports. But this clicks you that the patient has some problem. This is one of the template that I'm going to share. And somebody asked me, can you tell me how many patients were admitted last month? Can you tell me how many leprosy patients were diagnosed in past month? I can give you results within 5 seconds. It's because of the EHR templates we have, and we can click it right there and we get information. And so we have a lot of indicators. For example, screening malnutrition, chronic disease templates, dashboards, OPD cycles time, inpatient dashboards within last 7 days. So different indicators are there in Nepal EHR, and accordingly we work on that. So this is one of the examples that how this continuous quality improvement part is important. And this is like I can show you some of the pictures over here. There's like how many patients were enrolled, how many malnutrition patients were diagnosed, and these are like dark blue is patients' templates were filled with malnutrition screening part. And another one is about the templates filling percentage. How many templates were filled by our paramedics or the doctors who are working on that. And some of the examples of Pareto analysis, like what is the drug top most used? Omeprazole is the number one that we are using, and number two is ranitidine. Number three is ibuprofen. So this is the information you get it, and how that data suggests you is that, oh, we need this drug in large quantity for next month. That's what the inventory management will work. So this data is going to give you a highlights and how much budget has to be kept for next year. So this is the chart showing percentage of filling of the templates, like starting from the 50% and we are up to 60%, 80%. So this is the improvement we have done. So I was highlighting one example, like we had a lot of patients dying with COPD, number one killer in my hospital. So what we did was the study on that. This is open access to all of you that you can see, and the result is amazing. And what we got from the data is that we had done a lot of homeworks on that quality improvement project in COPD. That has showed that we have tremendously decreased in incidences of acute exacerbations of COPD in 3 months timeline. And the result is amazing, and the quality improvement part, that's we are working in the hospital itself. There are different templates. We are working in quality improvement about diabetes, gestational diabetes, palliative care, some other HIV/AIDS, drug-resistant tuberculosis examples. This is another example how we have highlighted mid-level practitioners in my hospital to have active learning and the implications of that active learning into actions. For example, a lady having a pregnancy with hepatitis B positive. I cannot get hepatologist or somebody who has that specialty in my hospital right away. But what we do, we make a lot of protocols. We have guidelines. And that guidelines is going to be implemented for all paramedics. And the paramedics knows, oh, hepatitis B positive pregnancy, so what is the management of that? We have the protocols on that. And this is called active learning. We are focused on it. The results are amazing. And we have these results, and recently published article that I'm also the co-author of that. And some other examples, monitoring and evaluations. So how many percentage of patients are filled, how many percentage of patients have got treatment, and that is already showing in the charts. If not, then we can do a lot of CME sessions and all to highlight these things. This is one of the dashboard that you can get it. Dashboard is like, it's a one-page dashboard. You can get it, the information is like 1 year informations, or 1 day informations, or 1 month informations. How many patients were admitted? How many patients with tuberculosis diagnosed? How many patients had diabetes?